Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program, and I'm Daniel Davis. On the program today, we're joined back again with a wonderful guest who is best-selling author of the book How to Outsmart Your Cancer. She's joining us today because there are many treatments that are available for alternative cancer treatments, but we're going to be discussing what men need to do to avoid and do before taking what is known as a prostate-specific antigen test in order to get an accurate reading. In other words, for the men out there, what you should not be doing is having sex for at least 48 hours before this particular test. I'd like to welcome to the Beyond 50 radio program today our guest who's going to share some insights on why this is, and that is Tanya Harder-Pierce. Tanya, thank you for being back on the program today.
Hi, Daniel. Thank you so much for having me again. It's a pleasure to be here to talk with you.
You bet. Now, go ahead first of all and give our listeners a background on what your expertise is.
Okay. Well, back in 2004, I came out with my book called Outsmart Your Cancer. It's a big book full of chapters on alternative cancer treatments. And it also has chapters on other things related to recovering from cancer. So I've been selling this book for a long time. In 2009, I came out with a second edition, and in January of this year, I just came out with my third edition. So it's all been updated and some new material added. And basically, the main gist of the book is to present really good alternative non-toxic cancer treatments for people who choose to go that route. Either they don't want to do chemotherapy and radiation, or maybe they can't because their oncologist is saying that there's nothing else that can be done or that those things won't work for them. And then I've actually seen a lot of people who at that point have gone to an alternative non-toxic treatment and had a complete recovery. But one of the things that is a little bit different about my book that some other authors who talk about alternatives don't do is I put in some chapters that also deal with related issues. Like, for instance, there's a chapter on what women need to know about hormones and cancer, and especially since women are often given hormone-blocking drugs. And I have a really interesting chapter as well, which is what I want to talk about today, on what men need to know about hormones and cancer, the PSA, how to understand it, and also about hormone-blocking drugs for men, which are those drugs that block testosterone, like Lupron and Casodex, that are typically given to men with prostate cancer. It's a very, very interesting topic, really important things for men to know about.
Now, it's pretty interesting when you talk about, for instance, going in for a prostate screening, that you suggest that what men shouldn't be doing. Let's talk about some of those.
Okay, yeah, and I wanted to discuss this today because I think it's really important. Um, so in general, I think most people know that the PSA test is a simple blood test that tests for something called prostate-specific antigen, and that's considered a blood marker for prostate cancer. So it's usually used as a early detection test, which is good in many ways because it's non-invasive, simply drawing blood. Um, However, what men are not told by virtually any doctor that is going to give them a PSA test is they're not told to avoid certain things before the test. And these are very important because what happens is the the normal healthy cells of the prostate gland, as well as prostate cancer cells if you have any, will actually release a higher amount of PSA when pressure is put on the prostate gland. So, in other words, and I can go into this in more detail in a little bit about why that is, but in other words, there's certain activities that put a lot of pressure on the prostate gland, like, for instance, riding a bicycle or riding a motorcycle. Even having a urinary tract infection, say you're a man with a urinary tract infection and you're on antibiotics, that's not a good time to get a PSA test because usually there's some swelling when there's an infection, and any kind of swelling is added pressure on the gland. The most interesting thing that is important to avoid is it's really important to avoid sex for excuse me, at least 48 hours before you get your blood drawn. And the reason for that is having an orgasm, or basically ejaculation, puts extra pressure on the prostate gland as well. And that will actually typically raise your PSA count anywhere between 48 hours, sometimes even up to 3 days before you get your PSA test, which can give you an artificially high PSA count. And there's reasons why you don't want an artificially high PSA count. So that's the one thing, the no sex for 48 hours before the PSA test, that most men really should know about, because a lot of men don't ride a bicycle or a motorcycle or have a urinary tract infection. But this is a common thing they should know.
So is it possible then that maybe perhaps men are getting diagnosed with prostate cancer as a result of this?
What happens is the it's not so much a diagnosis, because a PSA test tends to just give the likelihood or possibility of cancer. So what happens is usually somewhere around a PSA of 4, a PSA count of 4, is about the cutoff point. If a man has a PSA higher than 4, a lot of times what the doctor wants to do is do a follow-up diagnostic to see more clearly if they have cancer. And usually that follow-up diagnostic is a needle biopsy. Now, the needle biopsy, it's not exactly like a needle in like an individual needle that they stick into your prostate gland. It's usually sort of a punch device that they insert up the rectum, and it has a needle or maybe several needle points on it that then they punch through the wall of the rectum into the back of the prostate gland. And so what they're trying to do is find out if there are any prostate cancer cells in your prostate gland by doing this type of needle biopsy or punch needle biopsy. That's a more accurate way of finding out than just go by the PSA alone, because the PSA is not in itself definitive usually. However, there are some real problems with that punch needle biopsy that you want to avoid if you can. First of all, it can be very painful. Second of all, and this is really important, is it can actually cause a very dangerous infection, because it's actually going from the inside of the rectum into your prostate gland, and there can be bacteria that is transferred over. And there have been men who have gotten a life-threatening infection due to this procedure. So there's a risk there, and you don't want that. Another reason is that they can actually, the needle biopsies can actually spread prostate cancer if you do have it. So, for instance, you might be better off not having a high PSA, because maybe you don't really have prostate cancer, but if you do, you might want to find out about it in some other way, like maybe if you can have an ultrasound and see if there's a tumor or something like that, because a needle biopsy actually can spread the cancer by sometimes by drawing out the cancer cells, as the needle biopsy pulls cancer cells out for the laboratory to study. Then that can actually introduce some of those cancer cells into the bloodstream or into the lymph system in some way, so that sometimes I've actually talked to a number of different men over the years who were able to catch their prostate cancer very early with a PSA test and a needle biopsy, and then had their prostate gland surgically removed, and the doctors basically told them that they got it all, that they're cancer-free, there's no problem. But then maybe 4, 5, or 6 years later, they've got prostate cancer spread throughout their whole body and into their bones. And the reason probably was because of that needle biopsy spreading it. But then it didn't show up on scans until it had time to develop, and some prostate cancers are slow growing. So it's really, there's some real significant issues here, and there's also a fear factor. You know, if you really don't have prostate cancer and you do some activities before this PSA test that indicate you've got a higher than 4 count, and the doctor starts scaring you with the idea that you probably have cancer, that can be a very disturbing thing to go through, for one. And then, of course, there's the problems of the possible risks of the needle biopsy. So there are just a few things that men can do, if they know about them, that can help prevent having an artificially high PSA count, so that whatever PSA count they get will be more accurate. And it still might be a little bit naturally high. Say if a man has a calcium deposit in the prostate gland, that can happen, and that can actually cause the PSA to be a little bit high, and it doesn't mean they have cancer. So, well, I just went through all that pretty quickly. I hope it was
Oh, it's
okay.
a lot
and
of
that
good information, though. You know,
too
it kind
hard
of
to
makes you
understand.
wonder, too, sometimes. Has it ever been determined what causes prostate cancer in the first place? It seems to me that there was a time you never heard about this, and all of a sudden it seems like men were just falling off trees now, and everybody was having it. Or, it's just, it's like I was talking with you before about the idea of cancer itself. Up until about 60 years ago, it seemed non-existent. And now all of a sudden it just seems we're expected that, maybe 1 out of 5 of us is going to get it. And I sometimes wonder if maybe, the message that's being spread out there is, maybe not such a good thing. What are your thoughts on that?
Well, yeah, the statistics that are put out nowadays suggest that it's even worse than 1 in 5. It's more like 1 in every 2 to 3 people will develop cancer. So it's pretty bad. And you're absolutely right that in the old days, maybe 40, 50 years ago, 60 years ago, it was not near as prevalent as it is today. And in terms of prostate cancer versus other kinds of cancers, prostate cancer incidence has increased along with all types of cancers, but it's also started occurring at younger and younger ages. So in the old days, it was real common for, I think the most common belief was for doctors to say, well, most men don't get prostate cancer till in their late 60s or 70s, and they can, because it's usually slow growing, maybe takes 20 years to do them any real harm, they can generally live with it and not die of it. So that was a real common way to look at prostate cancer for a long time, but that has changed. So there are more and more cases of prostate cancer at younger ages, and along with that, more and more of those cases are a more aggressive form than we used to have. We used to have mostly very slow-growing cancers. Now the prostate cancers are more often fast-growing. And, the whole idea of what is causing higher incidences of cancer is a big topic. In fact, in my first couple of chapters in my book, I do go over that and talk about a lot of common reasons for the rise in cancer cases, and certainly couldn't cover them all because that would take a very lengthy book on just that subject alone. But basically just there's a lot of reasons caused by modern living, a lot of reasons, and nowadays even more so with all the toxins in our air, food, and water. Glyphosate, genetically modified foods probably contributing quite a bit. Even things like vaccinations and just a lot of things. I think that's probably too big a topic for the show, but
Well, yeah, and it's true that those can all be significant contributing factors, but it seems to me too that the message got so consistent, you would almost think that we were being marketed to
yeah,
more
that's
than anything. I mean, it's one thing to go after it and say, well, yeah, too much sugar in your diet could possibly lead to this, or those sort of things. But the fact that, you just expect that by the time you're 30, you're going to get this. So, here's our hospital and our treatment and so forth. And it just seems like the message has gotten too regular. And I kind of question that, I guess.
Well, I mean, it is a good question. From everything I've looked into, I think the prevalence of cancer is really high. And there's just so many reasons. I mean, a lot of people don't even know that having root canal procedures in your teeth can bring about cancer or contribute to cancer developing.
Wow.
Yeah, there's some real interesting work done on that. I have a chapter actually in my book on toxic teeth and the connection with cancer. Um, but there's just so much more than
Mm-hmm.
that as well. And my sense of it is that there isn't quite so much fear mongering about cancer as there is deceitful lies about how well conventional medicine can treat it. And so what's really happening is that conventional medicine is dismal at curing cancer. They can treat it, but that doesn't mean they can cure it. And so we have a very high rate of people dying from their cancer if they get cancer. And that's a whole other subject as well.
Right. What about hormone blocking drugs for men to work to
Yeah,
fight prostate cancer?
good question. I was hoping to talk about that a little bit today. So this is a real interesting thing too. One of the things um, I did with my chapter on what men must know about prostate cancer, the PSA, and hormone blocking drugs is I quoted a lot of research and material from a physician who has since passed on, but his name was Dr. John R. Lee. And he wrote some very famous books about hormones and cancer for women. One of his really popular books was What Your Doctor May Not Tell You About Breast Cancer. But he was also an expert on hormones and cancer for men. And he did a lot of research into it. And what he found is that there is a huge fallacy that has been basically a medical misunderstanding for decades about the testosterone cancer link. And testosterone is what these hormone blocking drugs are blocking. And the reason they block it, usually with drugs like Lupron or Casodex, there's probably several others too, the reason they block the testosterone is simply because the medical world has decided, really decades ago, decided that testosterone feeds cancer. But Dr. Lee has really led the way in trying to prove that that's not true. And he actually cites a lot of research in his writings. And in my chapter on this in my book, I refer people to how they can order his uh, booklet about this topic. But he actually found studies that showed that testosterone is cancer protective for men. And that actually makes sense because we've always known that there's much more prostate cancer in older men than there is in young men. And young men is when they have a lot of testosterone. So if testosterone were really something that feeds cancer, you would expect the younger men to have a higher rate.
Right. Well, it's funny too when you take a look at that logic of thinking, so to
Hmm.
speak. Now, I've said many times on the program, it seems to me that science will just prove anything it wants to.
Yes,
Now that
actually.
that being said, now you talk about a study or a series of studies that say, well, we think that testosterone actually feeds and promotes the growth of cancer.
Hmm.
Okay. Now, look, the human body has been around for quite a long time. Why would a bioorganism create something that would actually destroy itself more efficiently? That makes no sense.
Exactly.
Just
Exactly.
that's the only logic you actually have to use.
Hmm.
When you think of bacteria, which we're all made up of, it wants to be successful. Why
Yes.
would it build anything to do just the opposite? And you
Right.
have to go to those scientists or whoever these people were that did this study and look at them and
Hmm.
say, this is reasonable to you? Maybe you should find a different career. Because this obviously isn't working too well for you. So, anyway.
Very true. Very true. And actually, Dr. Lee found,
That's almost like saying breathing in oxygen can actually promote lung cancer. Geez, who
yeah,
was the genius that thought of that one?
exactly. I mean, I think you're making a really good point. Just to support that point, Dr. Lee found studies that were done by the University of Chicago that reported when studies were done on mice, where they pre-treated the mice with testosterone, those mice they could not successfully implant prostate cancer into those mice because they had pretreated them with testosterone. And on the flip side, if they didn't pretreat the mice and they implanted the prostate cancer, and then that prostate cancer started growing in the mice, then if testosterone was added at that point, the prostate cancer stopped growing. And there's just a lot of other research like that that Dr. Lee sort of looked into and found out, but it had already become such a medical concept and a medical fallacy. The really interesting part of it to me is how this relates to the PSA. Now, when doctors work with a man who has prostate cancer, the one test they want to do the most is the PSA test if they can, because of course it's a non-invasive blood test, so it's easy and it doesn't hurt. But the problem is when they block testosterone in a man, they actually block the production of PSA, and this is the part they don't understand. So what Dr. John Lee described, and what I go into detail in my book on, is that the prostate cells of the body require testosterone to make PSA. So when you artificially lower the testosterone by blocking it with Lupron or Casodex, then those prostate cells don't have the raw materials to make PSA. It's like if you want to make a cake and you don't have any flour, and you can't make the cake unless it's a flourless chocolate cake or something, but normally you can't make a cake if you don't have flour. It's like the prostate cells cannot make PSA unless they have testosterone. So this is where the misunderstanding comes in. The doctors lower a man's testosterone by using one of these hormone blocking drugs. They see the PSA count go down, and they think, yay, we're reducing the cancer, because normally, when cancer's going away, the PSA goes down. But what they don't realize is it has nothing to do with the cancer and whether the cancer is being reduced. It simply has to do with the fact that those prostate cells didn't have enough flour to make the cake. So it's a very, very strange combination of misunderstandings.
Now, I have to ask, though, when you put a book like yours out there, have you had any kind of backlash from conventional medicine about this, or has it been well received?
Well, I have not had any backlash, luckily. And there's a number of reasons, I think, for that. One is I'm not a medical doctor. I'm not a practitioner of medicine.
Right.
So I'm simply a researcher, writer who gets good information out to the public. And I quote a lot of doctors and scientists in the book. So I'm not under attack because of that to some extent. And I'm not practicing medicine. That's important. And trying to think what else I was going to say about that. What has actually happened is, there's been a lot of people who have read my book and maybe even tried some of the approaches in the book, and they'll go tell their oncologist about my book or about the approach they're using. And usually the oncologists have not heard of it or have not heard of the approach, and they tend to brush it off as, well, that can't.
As they usually do, yeah. I know everything, and every once in a while somebody comes along with something and threatens my livelihood.
Right. But then I've also had quite a number of readers who have bought my book, and then I've talked to them at some point, and they have told me that it was actually their doctor who recommended my book. So there's both sides out there, actually. So.
Well, that's good to hear. I mean, after all, the end goal is to help people to feel better.
Right.
At least that's what it should be. So.
Right.
I know I remember years ago I was listening to a radio show very briefly, and it was a doctor radio show. Apparently this guy, isn't busy enough in his clinic, so why not do a radio show? But there was a woman who called in and asked the question about the book Suzanne Summers had put out regarding her research on alternative treatments for cancer.
Right.
And the first thing the doctor came out of his mouth, these celebrities, they come along, that kind of thing you're talking about there where they just brush it off. And I thought, that's very kind of sad, actually, because you don't have this problem, but there are a lot of people out there that do. And they want to find, something, alternatives. I mean, anything could be better than chemotherapy and radiation or surgery, for crying out loud.
Mm-hmm.
And none of those things have been proven to be really solidly effective long term anyway.
Correct.
I think it's like in the range of 1 to 3% success rate. And I ask you out there if that's true. We're just saying, if that's true, would you go to Las Vegas with those odds? You never. I don't know. It gets crazy what's out there sometimes.
Yeah.
Go ahead.
I was just going to add to that the best tool that conventional doctors have for cancer is actually surgery, and that only works if the cancer is caught early and can be taken out without having metastases. But the reality is that somewhere around 3/4 of all people in America diagnosed with cancer have metastasized cancer when they're first diagnosed. So that's 3/4 of the cases that surgery is not going to be curative for. And then they have to rely on chemo or radiation or a combination of all the three, and it's just not going to be curative. And so they don't really tell you that, and they try to make there's a lot of marketing campaigns about how cancer is curable now if it's caught early, or how it's treatable, and really it's not true. It's pretty much all lies and deception.
Wow. Yeah.
And we can go into some details of that too. But what I wanted to say, there's one more thing about the PSA that's really interesting. And it goes back to the thing, what you were saying, Daniel, about how something in nature is, like testosterone, is not going to be bad for the body normally. And so there's a reason why the prostate cells produce PSA when they have pressure put on them. In other words, the way Dr. Lee describes it is when they are crowded. So if if your prostate gland is simply crowded by riding a bicycle, or or a motorcycle, or having an orgasm, then the PSA responds. The prostate cells respond by putting out more PSA. Now, what is the reason? There's always going to be a reason in nature for something like this. And what Dr. Lee found was that there's a lot of studies that have proven that the PSA itself, that's prostate-specific antigen, is actually anti-angiogenic. And that's really important because that slows down any progression of cancer if you have a tumor, if you have cancer developing. And anti-angiogenic means that it blocks the formation of new blood vessels. So one of the things about cancerous tumors is that many times they have a tendency to grow so fast they can outgrow their own blood system or blood stream. And so cancerous tumors can often stimulate the new growth of blood vessels to them to feed them better, so they can grow more. Well, that's angiogenesis, when they produce more blood vessels to a tumor so they can grow. The PSA is anti-angiogenic, so it can block the formation of new blood vessels. So if you do have a tumor developing in your prostate gland, you really want to have a lot of PSA, because that's your body, your nature's way of slowing down the development of that cancer. And that's what's so fascinating.
Well, we've certainly made a lot of great strides and steps. It's really quite comforting, I suppose, that when you see a cancer treatment commercial, that you hear them starting to use words like more holistic, alternative therapies, things like that. So it seems that's an industry that seems to be growing in the right direction. And that's pretty encouraging, and that people really, like with anything, if you hear it on the radio or television, that's great if it opens your eyes and maybe opens a door, but it's still up to you, the individual, to get out there and do your homework. Don't just passively listen to somebody and say, I'm going to go this direction. Really do your homework. And it's a fascinating journey anyway. So great stuff.
Yeah, and there are more and more people who are going more of a holistic route. There's more and more doctors who are evidence-based and sort of more natural and holistic, and that's all very good, because we do need to take responsibility for our own health, especially with so many toxins and bad influences in our environment. But there's still a huge number of people, and I would say a majority of people in our country, who aren't into the holistic stuff and who basically just have been indoctrinated their whole life to believe that the doctors can save them. And
Right.
so they do whatever the white coat says.
Yeah. Well, at least you've made the choice. So, well, Tanya, thank you for being on the program today. This was a fascinating topic to certainly bring up here. And your website is
Outsmartyourcancer.com.
And that's where you can find out about what you're up to. I know there's a blog up there, success stories. We like to hear those. A lot of resources, things like that. And just for the listeners out there, it is a fascinating book, Outsmart Your Cancer. You're going to really enjoy what you read in there. And again, as I've said before, if it opens the door, fantastic. But don't just walk through it and make decisions. Do your own research. Do your homework. And then that way you'll be armed better with more confident decisions about what you want to do. Tanya, thanks again.
Okay, thank you, Daniel.
You
It's
bet.
been a pleasure.
Thank
Bye-bye.
you.
Bye.
We want to thank you, the listeners out there, for joining us. You can discover more at Beyond50Radio.com. That is the number 50. We encourage you to sign up for our weekly e-newsletter and keep up to date with what's going on in the world of Beyond 50 as well as our upcoming shows. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program, and remember, wherever you are is where you should be.